Good evening, one and all. Today I am going to discuss a small topic which is very important for your career. And here, let us discuss about the first and foremost topic, that is embryology. And embryology will start with general embryology. And as I came to know, लाइक मैं दो चार बुक रिफर किया उसके लिए ऑर्गन्स में मैं देखा, उसमें कुछ मुझे अच्छा खासा पॉइंट्स मिला नहीं, बट टेंकेट में मिला. एंड टेंकेट में क्या पॉइंट मिला? जनरल एम्ब्रियोलॉजी में पहले वो डिस्कस करते हैं अबाउट जर्म सेल फॉर्मेशन, फर्टिलाइजेशन, देन प्रीनेटल डेवलपमेंट, formation of two germ layers followed by 2-3 germ layers, formation of neural tube and fate of germ layers, and last and not the least, that is neural crystal. And ये सब में हमें क्या पढ़ना चाहिए? We should all know about germ cell formation and its fertilization, then prenatal development. And in prenatal development we know that there are three phases. Two phases, it is 2 plus 1, and two phases are in embryonic stage, and one phase is on fetal stage. Then formation of two germ layers, that is outer ectoderm and inner endoderm, and followed by 3 germ layers, where few cells migrate from ectodermal layer medially, and they form the future mesoderm. Then the formation of neural plate, neural tube, and fate of germ layers, and neural crystal. न्यूरल क्रिस्टल बहुत ही इंपॉर्टेंट है, बिकॉज न्यूरल क्रिस्टल के बिना हमारा डेंटिस्ट्री एग्जिस्ट करता नहीं है. इसका मतलब है कि डेरिवेटिव्स ऑफ न्यूरल क्रिस्टल्स आर सर्टेनली बिलोंगिंग टू एनामल, डेंटिन एंड फ्यू पार्ट्स ऑफ अदर स्ट्रक्चर्स. देन डेवलपमेंट ऑफ टूथ. In development of tooth, we all should know about primary formation of primary epithelial band, the horseshoe shaped structure what we see in upper and lower arch. Then the histological and morphological classification of tooth development. Histological classification is 5: initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. And morphological classification is very clear: bud, cap, and bell. In bell stage, it is of two types: early bell and advanced bell. And here I want you people to highlight few things, that is name of all layers, that is like outer ectoderm and inner endoderm. And here layers are outer enamel epithelium, inner enamel epithelium, stellate reticulum, and stratum intermedium, and their function, significance, and their importance of this layer in tooth formation. Then transition phase. What do you mean by transition phase? It means when a cell, when the enamel organ transit from bud stage to cap stage, that is called transitional phase. In bell stage, when it changes from early bell to advanced bell, that is called transitional phase. Then derivatives of dental papilla and dental follicle. I'll give you a hint: DP, D for dental, P for papilla. Similarly, you can use this DP as D for dentin and P for pulp. Then the derivatives of dental papilla is dentin and pulp. Whereas dental follicle, it is very clear, it is about cementum and PDL. Okay. Then coming to root formation, as we know, when there will be development, when there will be formation of advanced bell stage, that time we will see cervical loop that forms by conjugation of outer enamel epithelium and inner enamel epithelium, and they form cervical loop. And there few cells migrate and induce few specialized cells that is called as HERS, or known as Hartwig's epithelial root sheath, and they form the root outline and form the total root. Now, fate of dental lamella is utmost important in exam, remember. Now, coming to enamel. In enamel, I want you people to highlight few things, that is physical and chemical properties of enamel. Physical properties in the sense what all subheadings comes here. They are color, shape, hardness, strength, permeability, and its significance physically. Coming to chemical properties, in chemical properties, we are going to divide a calcified structure. Whenever you are discussing about a calcified structure, we are going to divide it in two parts as inorganic and organic. In inorganic, we have to divide it in two parts as percentage by weight and percentage by volume. Remember, ये इतने इजी नहीं है, इसको ढूंढना पड़ेगा, आपको ढूंढ के आपको मेंशन करना पड़ेगा. फिर amylogenesis is utmost important in enamel. I mean, formation of enamel is called as amylogenesis. Amylogenesis. Genesis means formation. Amylo means enamel. Formation of enamel is known as amylogenesis. Okay, like that. Then do age changes in clinical constitution of enamel. In age changes in clinical constitution, don't forget to mention its size, its thickness, its volume, its hardness number. I mean, loop hardness number, and don't forget to discuss about the structural variation what we see in a newly erupted tooth and old enamel teeth. Yeah, that's all about enamel. Next, we will discuss about development of head. In development of head, as we know, head is formed into three parts as development of forebrain, midbrain, and hindbrain. And here we can highlight the formation of brachial arches and their formation and brachial pouch. I want you to highlight a few things that is called derivatives of brachial arches and pouch, which I have discussed, which already I have discussed in my previous videos. Next, we will go to anatomical landmarks. Anatomical landmarks is utmost important to memorize, because if you don't know the cusp, ridge, fossa, then it is difficult to identify the tooth structure, and you can't differentiate between left and right, central, lateral, canine, and so on. Okay, so definition, types, and its diagram. These things are utmost important, and you have to label it. When it comes to permanent maxillary central incision, I want you to do few subheadings, that is introduction, chronology and development, different aspects such as labial, lingual, mesial, distal, incisal. Then don't forget to mention special note. Special note is a point where you can highlight the important points behind development of, I mean, formation of tooth and is discussion. Thank you all. Don't forget to like and share. Good night.